My name is Michelle Vallelunga, a nurse with the Upstate Stroke Program. If you or someone you love has just had a stroke, we know this can feel scary and overwhelming. You are not alone. Recovery is possible, and we're here to help. In this short video, we'll explain what a stroke is, what causes it, and what recovery can look like. A stroke happens when blood flow to part of the brain is blocked, or a blood vessel breaks and bleeds. Without blood, brain cells can be damaged, which may affect movement, speech, memory, or how you feel. There are two main types. Ischemic stroke is when a blood clot blocks a vessel in the brain. Hemorrhagic stroke, a blood vessel breaks and bleeds. There's also a TIA, sometimes called a mini stroke. Symptoms may pass quickly, but it is a serious warning sign. As someone who's had a stroke, it's very important that you and your family members know the symptoms or warning signs of a stroke. Remember, be fast. B for balance problems. E could be eyes or vision changes. F could be face drooping. A could be arm or leg weakness. S could be speech trouble. And T is time to call 911. Calling 911 right away gives you the fastest care and best chance for recovery. Strokes are often caused by uncontrolled high blood pressure, heart rhythm problems, diabetes, or lifestyle factors. The good news is that healthy changes like being more active, eating heart-healthy foods, and taking your medicines as prescribed can greatly lower your risk. Even small steps towards changing some of these habits can make a big difference. Recovering from a stroke is possible, and every recovery is different. The brain has an amazing ability to adapt, called neuroplasticity. With therapy and practice, many people regain strength and skills. After leaving the hospital, your care team may recommend physical therapy for movement and balance, occupational therapy for daily activities, speech therapy for communication and thinking, mental health support for coping and mood, stroke clinic follow-ups for ongoing care. Keeping your appointments are a big key to recovery, and if you feel something is missing, please speak up. Support groups can make a big difference. They connect survivors and caregivers with people who truly understand. At Upstate, we host a local support group and even a stroke survivor camp for encouragement and community. Finding the right resources for information is also important. For reliable online information, visit the American Heart and Stroke Association website at www.stroke.org or upstate.edu/stroke. To summarize, having a stroke is a life-changing event. However, every step forward matters. With patience, therapy, and support, many survivors go on to live full lives. You're not alone, and you can do this. To help you understand, we have asked a stroke survivor, Dennis, and his wife, Danielle, to tell you a little bit about their experience.
I had my stroke when I was 51 years old. The stroke caused left-sided weakness, balance, coordination, visual and cognitive deficits. I was having a lot of headaches. After my stroke, I was unable to drive because of my vision and cognition. I had a hard time following simple directions for making meals or managing my medications or money. I needed help getting to and from places within the home because I was not aware of my left side. I was afraid I was not going to get back to being me. The therapy I did was physical, occupational, and speech therapy. They worked on getting me back to feeling normal again. I had a lot of hard times redeveloping my confidence in normal daily tasks. Even though it was a huge change and it was stressful, we got through it by praying, having patience, working hard with my therapists, and determination. I wanted to get back to my life. My caregiver, Danielle, helped me the most when she would encourage me and guide me through my deficits. She was supportive and always there for me. We worked together to get me back to being myself. Some of the most helpful people in my recovery were my wife, my physical, occupational, and speech therapists, my rehab doctor, and the Upstate Stroke Support Group. I'm deeply grateful to the medical team who saved my life and the therapy team who helped me get it back. Since my stroke, I take my medications, monitor my blood pressure, exercise daily, eat healthier, treated my sleep apnea, and keep up with all my appointments. I want to tell every stroke survivor to work hard, never give up, and to believe this is not the end of the road.